A number of local hospitals canceling scheduled surgeries because they simply don't have resources to care for COVID-19 patients and people recovering from surgeries. Some patients are being sent out of state for life-saving care.
And this all comes as we mark about 1 year since we received shipments of vaccines. 7 Action News reporter Kim Russell live at the Oakland County Health Department, taking a look at what health leaders say you need to know about where things stand. Kim.
You're right, Glenda. It is 1 year ago this week that we first got vaccines here in Michigan. I'm live at the Oakland County Health Department, and tomorrow they mark 1 year from the time that they gave their first doses out to people in the public. Health leaders I spoke to today, they say that vaccines saved thousands, maybe even millions of lives, but so many people are unvaccinated at this point that we are still in a crisis situation in many hospitals. In the last year, more than 6 million Michiganders ages 5 and older have received at least one dose of a COVID-19 vaccine. Henry Ford Health System Medical Director of Infection Control, Dr. Dennis Cunningham, says that helped our health system and saved lives.
If we didn't have these vaccines, I am sure we would have many, many more hundreds of thousands, if not millions of people dead in this country.
But millions are still not vaccinated in Michigan, and hospitals right now are in crisis. While vaccine protection weakens after 6 months, leading to more breakthrough cases and the recommendation that people get boosters, Dr. Cunningham says hospitals are seeing COVID-19 lead to more hospitalizations and deaths for the unvaccinated.
Most of the people who are admitted to the hospital have not had any vaccination. We're starting to see a few people who were vaccinated get admitted to the hospital, but they tend to be much less severe, and they tend not to get intubated.
This is key for the hospitals right now. The Henry Ford Health System and Michigan Medicine announced they are canceling some scheduled surgeries because they simply don't have resources to care for the number of people sick with COVID-19 and those recovering from surgery. Smaller hospitals are being forced to send patients out of state for critical care because local hospitals are at their limit.
Our ability to take those patients, as we have in the past, is restricted. I am hearing from colleagues all around the state that sending patients to other states, to Indiana, to Ohio, and making more than a dozen calls to try to find a place to have a patient cared for. These are the realities right now.
Dr. Brad Uren is an emergency room doctor at the University of Michigan. He and others are concerned the situation will only get worse as people gather for the holidays and potentially as the Omicron variant spreads.
This affects everyone. Everyone watching this may have a friend or a loved one or themselves that will require emergency care at some point.
Both of these doctors that I spoke to, they're asking you, if you're not vaccinated, to get vaccinated to help them continue to be able to offer care, to not have to send patients out of state. As they say, most of the patients that they are seeing with severe symptoms, needing the most care and the most attention, are unvaccinated. Here at the Oakland County Health Department, they still have vaccines available, as do many pharmacies, stores like Costco, Meijer, Kroger, many places around our area offering vaccines still. Reporting live in Pontiac, Kim Russell, 7 Action News.
Hopefully we can find our way out of this situation for good, Kim. Thank you.